So far in our lecture, we talked about the acute rhinitis, chronic rhinitis, what are the different types of acute rhinitis, different types of chronic rhinitis, what's hypertrophic rhinitis, and then we talked about atrophic rhinitis also, what are the different pathological factors that leads to the signs and symptoms which are associated with these different types of rhinitis. So now in this section, which is also the final section of our lecture, let's talk about some other forms of rhinitis. In this section, we will talk about the rhinitis sicca and then the treatment of rhinitis sicca, and also we will talk about rhinitis caseosa. Other forms of rhinitis, we have rhinitis sicca and rhinitis caseosa. Rhinitis sicca, usually it's crust-forming disease seen in patients who work in hot, dry and dusty surroundings, for example, bakers, iron and goldsmiths. So people who have this mainly occupational type of rhinitis, people who work in an environment which is hot, dry and dusty, like people who are in the bakeries or they bake, that they have very hot environment, and then the people who are working in the iron and gold mineries and iron and goldsmiths. So all these are the different presenting features or causative factors of rhinitis sicca. Confined to the anterior third of nose, ciliated columnar epithelium undergoes squamous metaplasia with atrophy of seromucinous gland, more or less same as I mentioned in atrophic rhinitis also, that there is a change of ciliated columnar epithelium into the squamous type, stratified squamous. So here also ciliated columnar epithelium, it undergoes change and become squamous metaplasia, and there is atrophy of the glands also. There is formation of the crust also here in this condition also. So more or less it resembles with atrophic rhinitis, and that also there is a brownish black crust formation which are foul smelling in atrophic rhinitis. So crust formation here also. The treatment is usually correction of surroundings. If it is due to some occupational reasons and it's troublesome or it's bothering, change in the surroundings is important. So correction of surroundings. Application of ointment, antibiotics, steroids. Avoid nose pricking and forcible removal of crust. It should be avoided. It can cause epistaxis or injuries, trauma to the nose. Nasal douche is useful. So that's all the treatment option for the rhinitis sicca. Rhinitis caseosa, uncommon condition, it's not very common. The features of this type of rhinitis is unilateral and mostly affects the males. Nose is filled with discharge and caused by chronic sinusitis with collection of cheesy material. It's a cheesy material, that's why the name caseosa comes from the cheesy material. Bony walls of sinus may be destroyed and there is malignancy. Sinus mucosa becomes granulomatous also, and there is prognosis is good. So the good thing is it's not very common, it's rare, and even if it does occur, prognosis is good. More common in males, usually it has cheesy like material is produced or collected, and that cause filling of the nose, and it is can also cause mucosa becomes granulomatous, and walls of bony walls of sinus may be destroyed. So all these are the different features of rhinitis caseosa. Treatment is removal of debris and granulation tissue. If you see here, very good picture of formation of granulation tissue. So granulomas are formed. Free drainage of affected sinus is important. So that was all about rhinitis sicca and caseosa. So this concludes our topic of acute and chronic rhinitis, in which we discussed almost all the types of rhinitis, how it presents, what are the pathological features, and how we can treat and manage different types of rhinitis. So hopefully you learned about the rhinitis and you know a lot more about the rhinitis after this lecture. So thank you for watching sqadia.com.